What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for September 16, 2020. The critical role of faith communities in fighting COVID-19. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, guest host Dr. Panagis Skaliatsatos, otherwise known as Dr. G, interviews Dr. Daniel Hale and Imam Hassan Amin. Dr. Hale is the Director of Healthy Community Partnerships at Johns Hopkins Bayview Hospital and the author of a book on faith communities working with healthcare organizations to improve community health. Imam Amin is the founder and director of the Muslim Social Services Agency in Baltimore. They speak about the critical role of faith communities in fighting COVID-19. Let's listen.
So thank you so much for joining us today. My name is Panagis Skaliatsatos, an assistant professor at Johns Hopkins School of Medicine. I am honored today to have two colleagues, one at the School of Medicine and one out in the community, doing what we can to battle COVID-19. First, Dr. Daniel Hale, a special advisor to the president at Johns Hopkins Bayview Medical Center, director of Healthy Community Partnership, and holds joint appointments in the Department of Psychiatry and Behavioral Sciences and Division of Geriatric Medicine and Gerontology. So Dr. Hale, my first question to you, what advantages does working with faith-based organizations have in the management of diseases?
Well, thank you for inviting me today. And yes, I have found that there are a number of advantages. When you think about the common chronic diseases we see, for example, heart disease, hypertension, diabetes, you realize just how much responsibility for managing these conditions falls onto the shoulders of the individuals themselves and sometimes on their families too. These diseases certainly require the attention of physicians and other medical professionals, but so much of the actual care itself is provided in patients' homes and by the patients themselves. They're the ones who have to monitor and manage their conditions on a regular basis, which means that they need to have a good basic understanding of the disease and the treatment strategies that have been recommended. Faith communities, working with medical professionals and institutions, can provide and then reinforce this basic medical information that people need. For example, they can explain and then remind people how important it is to monitor and control their blood pressure. They can point to the potentially serious consequences of failing to do so. And it's especially effective when this message comes not only from their medical provider, but also from a religious leader they respect and trust, or from a medical professional who has been invited by their religious leader to talk with the congregation. And then there's the role volunteers can play. Members of the congregation can be trained to do some of the monitoring on site. When people have come to their house of worship for services or other gatherings. Great examples, providing blood pressure checks. It's a way to take health care to the people. Also, some of the treatment recommendations may involve modifying a person's routines and behaviors. They may need to alter their diet or increase their level of physical activity. As a psychologist, I can certainly testify to just how difficult changing well-established behavior patterns can be. So it's helpful to have the encouragement and ongoing support of fellow congregants. You ask about managing diseases, but I think it's important to note that faith communities can also play a role in helping people prevent or at least reduce the risk of developing some of these diseases, providing them with the information and support they need, and offering screenings that can detect diseases in their early stages when treatment can be more effective. One more advantage I'd like to mention, and one that I believe is sometimes overlooked or not fully appreciated, is that these type programs can have the result of improving the direct care provided by physicians and other health professionals. Because by working closely with faith communities, and listening carefully to their leaders and members, health professionals can develop a better understanding of the lives and experiences and circumstances of the individuals for whom they provide care. They can learn about some of the challenges that, if not addressed, can interfere with monitoring and managing these conditions. And they can learn how to communicate more effectively. I think all of this is important, especially in our increasingly diverse society.
Dr. Hill, thank you so much. That is incredibly well said. And to me, it makes sense in this notion of the way we all train as physicians, as scientists, as public health officials, right? It's to know the science and to know the individual who has it. But by knowing the community, by actually working with the community, the churches, synagogues, and mosques out there, and temples and so forth, you have another advantage in regards to promoting health and preventing disease.
Absolutely. Absolutely.
It's a fantastic, it's an idea that some people may say it's novel, but it's just always been there. Like it just takes a human step of connectivity.
Right. Yes.
With that said, a lot of what you discussed makes sense for the normal world, right? The pre-pandemic world. And now we are in this pandemic with COVID-19. And you hear this rush for vaccines, you hear this rush for antiviral medications. But this strategy that you discussed, tell us how the advantages with a community engagement between a hospital and a faith-based organization, tell us how this has transitioned during the time of the pandemic and what advantages it holds.
Sure. No, thank you. I think the advantages are just as great, if not greater. Accurate, reliable, easy to understand information is key to saving lives and getting the pandemic under control. And we know that there's been a lot of misinformation circulating, especially on the internet. But people need to have a clear understanding of this coronavirus that is threatening us on a daily basis, that it can be deadly, that it's highly transmissible, that you can have the virus and not have any symptoms, but still transmit it to others who then could become seriously ill and even die. They need to understand the precautions that are being recommended by medical experts, exactly what is it they should do, and the importance of taking these precautions. This information provided by religious leaders they know and trust can have a tremendous impact. It can literally save lives. And that's not an exaggeration to say that. And it's more than just information. Sometimes there's tangible assistance that faith communities can provide. Face masks are needed. Some people need assistance getting food safely. And many need emotional support as they self-isolate. This can be a very lonely, discouraging time. Also, religious leaders can, and I believe should remind us, that it's not just about self-care. It's more than just protecting yourself from the disease. It's about caring for others. All faiths emphasize the responsibility, the mandate to care for others. And with this pandemic, we have that opportunity. And I believe the responsibility to do that every single day. It's part of how we could live out our faith on a daily basis.
Dr. Hill, that transition is important. You're right. We're really battling two pandemics, one of an actual biological virus out there, SARS-CoV-2, and the other one, that of misinformation that holds just as much dire health outcomes if people aren't given the proper information where they can socially distance, wear face masks, and so forth, to understand what is needed at this moment. The misinformation holds the ability to undo a lot of great public health initiatives and so forth. And you're right, working with faith-based organizations, it's a trusted source for the community, and they're going to trust that information. So partnering with them just makes sense. I'm going to ask you one question. Our listeners probably listening at the moment probably are thinking to themselves, that sounds like a great idea. Dr. Hill, what is one recommendation? So say someone wants to begin doing this, partnering with faith-based organizations. What is one recommendation you can tell them to begin that partnership?
So I think one, they can read about this, several places that they could find some literature on this and some guidance. I would encourage them, if their hospital, medical center has a spiritual care, or pastoral care, or chaplaincy program, to reach out there. That's already often a point of contact between the faith communities and the medical centers and hospitals. So that would be the first step, is to, try to learn enough about it. They could talk intelligently, informatively with their spiritual leader, and then reaching out to the chaplains or pastoral care staff at the hospital.
No, it's an important step, and one to just emphasize again. In order to approach a community, it is highly important to be able to be aware of the community, who they are, and so forth, and go out there with a sensitivity of the culture so you can come at it in a sense of, I have never walked in your shoes. I'm ready to walk next to you. So that is a great recommendation, and especially using the chaplain services. They're oftentimes the liaison between the community and the hospital.
Right.
Last question to you is, what have you learned from working with faith-based organizations during this pandemic?
So this has been a very gratifying experience. What I have seen has reinforced my long-held belief in the value of religious institutions in our society and the role they can play helping to improve the health and the lives of their congregants and their neighbors. We have found that people are eager to obtain the tools they need to care for themselves, to care for their loved ones, and to care for the rest of the community. They want to be educated, equipped, and empowered. And we have received so many expressions of gratitude for providing them with valuable information and other resources. So this has been gratifying, encouraging. In fact, it's really encouraged us to not only continue, but to expand these efforts.
Excellent. Thank you, Dr. Hale. That was very well said. And for the listeners out there, you've already heard of step one. If this sounds like an idea needed at the moment, we would highly encourage it. And thank you, Dr. Hale, for simplifying as much as we can. Any tool that we can have in order to make a dent in this pandemic, I think is 100% worth exploring. And just to show you how much value we can have when medicine and religion partner, I'm going to turn it over to Imam Hassan Amin. Imam Hassan Amin is the founder and executive director of Muslim Social Services Agency. He's also collaborated with Dr. Hale and myself over the last 2 to 3 years, where we've worked with him from community engagement to Syrian refugee health issues, mental health, high blood pressure. You say it, we've challenged it, we've worked with it together. And Imam Hassan has really been one of the frontline community leaders where I believe he is saving more lives than any doctor or nurse ever could because of the community engagement and the trust he has. So with that, Imam Hassan, salam alaikum, and thank you so much for being here today.
Wa alaikum salam. I want to thank you for inviting me, and also Dr. Hale for his presentation, which I learned a lot from it over the years. I just can't get enough of learning from you, Dr. G, and also from Dr. Hale. Before you even ask me a question, I want to mention something that I agree 100% with what Dr. Hale said, and I want to just reinforce that by saying also with the faith-based organizations that we as imams and clergy, we also accompany people who may be afraid to go to psychologists or to a medical appointment. We someday trust us, and then we can also accompany them to whatever appointment they're going to until they gain more trust from the psychologists or from the medical professionals, and then we sort of back off, because we also have a code of silence, if you will. If someone tells us certain things to the clergy or to a social worker or to a doctor, then also to a lawyer, then we can't reveal what the person said unless, of course, they're going to be harmful to themselves or others. Then, of course, we would have to reveal it. Otherwise, the patients, they have a trust in us as clergy, and we will go with them to the appointment. I also want to mention that the partnership that we have over almost 3 years, maybe going on 4 years, is that, Dr. Hale mentioned about accurate information, is that we can bring professionals like the two of you, Dr. G and Dr. Hale, bring you all and other people who are associated with you in your profession. We will bring you to the community to give them accurate information pertaining to whatever it is that they need to know, and not become doctors or get information from the internet or social media or from their best friend who think that they know everything and they don't really know anything about what they're discussing, and they're outside of their skill set. So can I continue?
No, so actually, I'm going to pause you there because I want to be able to now, the next part of this, I want to put it under a question because I feel like I know where you're going with this. And Imam Hassan, I love what you've said up to this point, because you're right. I mean, you have a trust with individuals, you're there for them. And in a time like this now, the pandemic, fear is everywhere. I mean, we see the numbers rising, we see concerns. And so I imagine your community is turning to you as clergy, as a trusted member more than ever. So everything that's built up in your life of working with the community, earning their trust and so forth. Tell us about your efforts now during the pandemic and how your role has changed or maybe not changed. Tell us right now what's going on with you and your community in the pandemic.
Well, right now, Muslim Social Service Agency, we've been around since 2003 for providing services and resources free of charge to individuals and families that are in need to help them to improve upon the quality of their life. So we've been doing this for a while. But presently, under the coronavirus, is that people are they're hurting and they're hungry and they need help. Right now, we're helping people with food. After right now in Baltimore, not only just Baltimore City, in the state of Maryland, is that the person who are landlords or the mortgage or the banks, basically can't kick people out of their homes. And a lot of people lost their jobs, but they can't kick them out their home. But after the different phases, go through phase 3, or we regain some sense of normalcy again, then the bill collectors, they're going to want people to pay. Right now, we're trying to at least get people fed, get their bellies full so they won't be as hungry as they are because they don't have the money in order to buy the food. Then we know maybe in a few months or so, if everything calms down, particularly in the state of Maryland, then they're going to need help with rent. And so we're trying to get the money together to help people with rent. Additionally, people are going to need help with jobs because some of the people, they lost their jobs, living and working in restaurants and other places. Some people that I work with, and particularly in Baltimore City, they are the last hired and the first fired. And so these are the people that are really hurting right now in terms of being able to pay their rent, food on the table, and also getting a job. Last weekend, by the grace of Allah, we put together a team of different organizations, nonprofit organizations, including Medicine for the Greater Good, which is our partner with Johns Hopkins Bayview, which is Dr. G, I think, is a co-director of the program, founder of the program. I think Dr. Hill is part of it too. And last weekend, we gave out water and fruit, fresh fruits and vegetables and hot meals and hand sanitizer. And also we gave out food gift cards. Throughout this pandemic, we're giving out at least almost $39,000 or $40,000 worth of food gift cards, either to Syrians or to non-Syrians, to African-American, non-African-American. It doesn't matter to us the color of the skin or anything like that. It's just the need. We don't ask you any questions or show us any ID. We just going to trust that you are in need, get in line, sign up, and we give you the food and other things that we have to offer. And so I want to mention this last thing is that we hear this saying, sort of a slogan, with that we're in this together. You see it on all the commercials throughout our TV sets on radio. And so if we are truly in this together, then all of us need to help each other right now and over the coming months by donating to organizations that are helping people get through this particular virus right now, people that are hurting and hungry right now. And so we need people to help us to help them. So we're in this together, then don't just make it a slogan and something we want to say, just be saying because it feels warm and fuzzy. No, be active. We in this together by helping an organization that are trying to help other people.
Imam Hassan, well said. And the points I want to emphasize that we said earlier, we don't have a cure, we don't have a vaccine. And so these kind of behavioral interventions that we have, they're going to be said, but the community is going to struggle to abide by them for a variety of reasons. And what you are demonstrating is how a trusted community organization, a mosque, a church, a synagogue, can be there with its clergy to be able to deliver interventions, food, meals, jobs, right? Bless your heart. I mean, you are helping people to abide by these public health requests because they now have the resources to be able to do that. And I love the last comment. Dr. Hale led us, his last comment was talk to the clergy of your chaplain service of your hospital in order to begin that conversation with a local community faith-based organization. And Imam Hassan, you've closed it off with action, right? It's not a slogan, action. Donations to boots on the ground. So thank you both. In this pandemic, the only things we can rely on is each other. And I'm hoping the listeners of this podcast are now motivated to begin to work with the most trusted organizations of a community, of a city, of a neighborhood. And so reach out, grab those community leaders. And all of us, honestly, Imam Hassan, you said it well, we are all in this together, but listeners, make it an action. So thank you both so much and take care.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.